Hello, my name is Laura Mosqueda. I'm the Dean of the Keck School of Medicine, and I'm delighted that we can show you what the next phase of your training could look like. July 1st is a very exciting day.
The lab coat, for sure. Yeah. We go from like a short coat to a long coat.
It's when I welcome our new interns, residents, and fellows.
The amount of exposure that we get as students at LA County and Keck and all these different sites is incredible.
Good morning, Mr. Reed. Oh, do you have the CT scan?
Yeah.
Let's pull up that CT scan.
So this is the CT scan from the first day.
We are smack in the middle of it all, right here in this health sciences campus. So we have a county hospital right across the street that has incredible, not only inpatient, but ambulatory facilities. Right across the street in the other direction, we have our Keck hospital with wonderful ambulatory and outpatient surgery sorts of facilities. Then on my right, we have our Norris Comprehensive Cancer Hospital. And then just across the street, we have our major research buildings too.
This one is unique because it's for cranioplasty.
Research and education are really the foundations upon which everything else at the School of Medicine is founded on. You have multitudes of opportunities to do bench work, clinical research, translational research, and really take your work from the bench side to the bedside.
Hello. Hi, Lauren. How are you doing? I'm well, thanks.
This week, in fact, we've had a sickle cell patient, an aplastic anemia patient who came for treatment. We get TTP patients. We have 3 to 5 autologous stem cell transplant patients on at any given time.
I've been here 44 years, and there's 2 common foundational principles. Number 1, patient interests supersede self-interest. This is absolutely critical.
Your levels are coming down, looking good. So you're thinking discharge?
Yeah, I think you can go home today.
The second is that this is a teaching center, and we talk about the very famous professors that are here to teach you. But the one thing everybody learns is that the master teachers are the patients themselves.
And so, sir, we're going to show you what you actually had before and after. Okay? This is what you came in. That's what you came in with. Nearly locked out that entire lung, right? Yeah. Oh my gosh.
You must have a passion. Part of your mission is to take care of the underserved. We are serving the underserved. We are serving those that are more socioeconomically advantaged. But essentially, you want to serve everyone and everybody and serve them the same, regardless of who they are.
So who's our next patient? In here?
Yeah.
Okay.
These are the patients that, you know, it's not just a pleasure to serve, it's an honor to serve.
They're my people. I see myself reflected in the population.
I really wanted to come back home in more ways than one. This could be my mom, this could be my dad, this could be my uncle. And no other place could afford me that opportunity besides here.
It's been the most challenging and rewarding thing I've done in my life, being here. I've been pushed in ways that I didn't think were possible.
We're looking for that spark in a person that's going to become a good physician who's going to put the patient first.
Can we get Dr. Diggs in here, please? Can we get some backup?
No matter how dramatic this scenario is, it's something that happens.
Patient just went non-responsive, her blood pressure dropped. We are pretty much in the ORs from day one. We do cases that other places just read about in textbooks.
You really want to care for the caregiver. Our goal is to prevent burnout before it even happens.
Takes about 8 months till you start thinking, I can do this, I can master this.
Do you see anything worrisome at all? Anything new? No, I don't.
This is not a movie, this is for real.
Can you show us 2 fingers?
It's really important that not only do they listen to what the attending has to say, but equally important, the attending needs to listen to what the resident has to say.
Show me where your pain is.
We're here to learn. There's no dumb questions ever.
We really want an inclusive environment where you can be the thought and the change leader on our campus.
It's so important to know that you're part of the Trojan family. That's not just a catchphrase here, it's something that we really mean. We care about the people who are here. We care about you after you leave. It's a lifelong commitment on our part.
I'm Dan Logston. I'm a cardiothoracic surgery integrated program at USC. This is my 6th and final year of training. So we have a total of actually 14 residents in the program, 12 that are in clinical training, and then we take a research year our 4th year. So it's typically a 7-year program, but the 4th year is a non-clinical year. It's a research year. So each year we have two residents in each year, so it makes a total of 14. I think USC, when you look at training programs, especially in something so specific as cardiothoracic, what we really look for is a training program that has mentorship. Case volume is always a concern, but I think most programs across the country have case volume, but it's really, with those cases, are you actually getting to perform them? Are they walking you through a stepwise fashion in terms of how to learn how to do a case? You're not just getting dropped in and asked to perform, you're kind of stepwise taught through it. And I think the beautiful part about integrated program is that we've been here since year 1, and so I know what it's like to be a first year intern, and now I'm a 6th year, technically 7 years, but a 6-year chief resident. So I remember what it was like to be an intern in a 2nd year. So being able to really, right now I'm on a county rotation and I'm able to walk that 2nd year resident through cases and kind of just build upon their surgical experience. So you start by opening chest and then by putting somebody on bypass and then little basic parts of the procedure, because now that I'm comfortable with that, it actually benefits my training to be able to teach. And so I think that's kind of the power of the USC program, is it's really built around the people. The cases are there wherever you go, but what really is important is, one, the mentorship you get from faculty, which I think is unparalleled, which is one of the reasons I'm here training. You have Dr. Craig Baker, who's our department chief. You have Dr. Starnes, who's the department chair, who's also a cardiothoracic surgeon. And then the other staff that we have, it's a lot of hands-on teaching, clinical training that you just don't always get from a faculty. And then from the resident side, a lot of the teaching is required of the chief residents and the senior residents to educate those before us. And having gone through that, you really need to kind of know where they are and what they need to learn to get through that. So that's the biggest part of this, is the people that are here. You reach a certain level of comfort, which you don't think you'll ever get to, but you do, to where you're comfortable helping somebody out of a problem, so you're okay if they get into it. And that's part of learning. If you have a kid, I have a 5-year-old son, it's he's got to get into some mischief to learn how to get himself out of it. As long as I know that I can get him out of it and he's relatively safe, that's the best learning opportunities. We do over 1,000 cases at USC. At Huntington, we're doing probably 250 to 300. LA County is probably another 200. And then if you include Children's Hospital in there, which is another 12 to 1,500 probably cases, you're looking at almost 2,500 to 3,000 cases. Plenty. We have 4 institutions that we train at here. Our university hospital, which we refer to as Keck, is a tertiary care center. So we see a lot of the complicated cases there. Ranges from our transplant programs of heart and lung, ventricular assist devices, and then what we call extracorporeal membrane oxygenation, which is ECMO for short. So these are some of the sickest patients that cardiac surgeons take care of. And then on top of that, we do a lot of redo operations there, a lot of complex valvular surgery that doesn't happen out in the community and gets referred in. And then our other 2 adult hospitals, we have Huntington Hospital, which is a private hospital. And there you're going to get kind of the experience of more of a private practice surgeon. You're going to get a little bit more of your typical bread and butter cases there, valve surgery and coronary surgery. And then the county hospital is kind of the real gem here, because it has a mix of the complicated cases, because you see patients that oftentimes haven't been medically treated up until the point that they come in. So you see disease processes that are very far progressed, especially one thing that we see a lot of is rheumatic heart disease. It's not seen a lot of other places, but is seen here just due to our patient population. And then on top of that, as the resident over there, you're in charge of everything. So you're in charge of the intensive care unit, you're in charge of getting the patients into surgery, taking care of them after surgery, and then also seeing them in the outpatient setting. So it really is, I've kind of adopted it as my own practice when we're over there. And we typically rotate, we'll do 4 months of adult cardiac surgery at Keck Hospital, we do 2 months of adult cardiac surgery at Huntington, 2 months at County Hospital, and then our second and third years, we actually rotate as a junior resident over to the Children's Hospital for 2 months each that year. So that's a total of 4 months of children's. And then each year we also incorporate in thoracic surgery. So oftentimes people forget that, people think of just heart surgeons as heart surgeons, but we also do the lung and esophagus. So our third year residency program, we actually are the chief resident at the county hospital. So our third year of residency, we're responsible for all the lung and esophageal cases that go on at county. So that's really your first introduction to kind of being in charge, having all the responsibility fall on you. And I don't think there's a program in the country that does that. And there's so much growing pains that occur with that, but it can become some of the best 6 months of your training. And so we do the 6 months of thoracic there, and then we come back to Keck Hospital and do a total of 2 months of thoracic, so each of our 4th, 5th, and 6th years. So it turns out to be a total of about 12 months of thoracic surgery as well, on top of the cardiac training that we discussed. I think residency is just full of growing pains, and you don't necessarily always realize it when you're in it. You realize the weight of what you have to know and how excellent you have to be every day at what you do. And so, and after third year, I mean, you still have some of that. You have some of that when you hit your 4th year, because it kind of happens in the cardiac realm. You go over to Keck and you become a kind of a chief resident over there, responsible for a very large service of many different attendings with very sick patients. And so you really start to feel the weight of it. And then over time, you start to realize that, oh my gosh, I'm actually learning this. And then when you kind of hit your stride, kind of where I am now in my chief year, you know, there's still a lot to learn, but there's a lot of information that you realize you've collected over the last 6 years that you're now applying, and you realize it's almost like, I always relate it back to playing sports. At some point when you first start playing a sport, it's very fast. You watch an NBA basketball game and those guys are all over the court and you're like, how are you even following the ball? Or watching hockey players follow a puck. It's really hard to do, but at some point that game slows down to them, so where it's almost like acting in slow motion. And I think it's the same thing in residency. You start to, you know, at first everything's coming at you and you can't visualize all that's happening, but eventually you start to see the plays develop in front of you, and it slows down. And that's when it becomes really enjoyable and you can really start to make the key decisions that impact outcomes long term. One of the hardest parts of residency, and even in medical school up to this point, is just not losing yourself, not losing your health. 7 years is a marathon. This isn't a 6-week or, you know, 3-month course in college. I mean, this is your life. This is 7 years. And so you have to put yourself kind of first a little bit. You have to think about taking care of yourself. Now that our program has developed the way it has, we really work on trying to cover for each other. And that's been one of the things that myself and the other chief resident have kind of promoted, is just this idea of like, hey, we'll help cover for you, you know, to make sacrifices for the family things. Like this weekend alone, the resident that's on service with me now, she wants to go back to visit her family because she's off for the weekend. So we said, hey, you know what, take Friday off, take Monday off. I'll work on covering the rest. So we just kind of take the burden a little bit from each other. It kind of perpetuates this idea of, hey, you know what? Family is priority. Your time off is priority because you have to take care of yourself.
Once you've done a residency or a fellowship here, you are ready for the next phase of your career. And that might be going into clinical practice, it might be going into academia, it might be going on for more training. Whatever it is, be assured that you are going to be the most well-prepared person possible for that next part of your career.